Welcome back, everyone. This month we celebrate the vital role of oncology nurses in the individual fights against cancer. Sabina Suggs joining us today. She's a registered nurse for Intermountain Healthcare. So glad to have you here with us today.
Thank you so much.
Let's first talk about an oncology nurse, what they do, and the vital importance they play in a hospital, and specifically for someone who's fighting cancer.
Sure. So as an oncology nurse, we deal with people who obviously have had a diagnosis of cancer. Which, just in the diagnosis itself, as a nurse, you're treating the whole person, not just a disease. So I think that's part of the vitality of the oncology nurse, is that you are aware of what the patient needs above and beyond medical care. You need to be aware of what they need psychologically as well. So helping them through the diagnosis, through the treatment, through the recovery. It's a very long process, not only for them, but for their families as well.
Doctors are so important and so fantastic, but it's the nurses who are there in those really trying moments of such hardship and something so terrible. And unfortunately, you know firsthand about both sides of this situation. So let's talk about, you were a patient in your own department. I
was, the very floor that I work on, room East 848. So 3 months after I was married, I was diagnosed with leukemia. I was not symptomatic at the time, and unfortunately, that is a way that a lot of our patients are diagnosed, is they are not symptomatic, but something eventually takes them into the doctor. 3 months after diagnosis, I underwent a bone marrow transplant where my brother was my donor. And you know, once you're diagnosed with cancer, it's something that will follow you the rest of your life. But as I get older, I'm like, I'll celebrate those birthdays because I'm still here.
You are, and how are you doing now? You look great.
Well, thank you. I feel good. I still get an annual blood check, and about the 10-year mark I had a little something scary where my Philadelphia chromosome, which is the mutation in the DNA for my type of leukemia, was positive again. But it's not a remission, it's not a relapse, or it's not a relapse. I'm still in remission, and as far as they are concerned, I'm at no greater risk than getting it again than anyone else.
Which is such good news, such a wonderful thing. And your unfortunate situation, I'm sure, makes every day on your job different. So how has it impacted the work you do?
So one of the reasons why I love what I do is I'm able to share my story with my patients. And knowing that everyone has their own path, and that the obstacles they may encounter may be different than mine, knowing that people can survive, that they can go on living a normal, quote unquote, normal life after cancer. And I focus on not only surviving cancer, but continuing to living your life, because their life is continuing going on while you're fighting this battle. And so it's so important to remember that you know, while this is a big part of your life, it doesn't determine the rest of your life.
I love that. You also started a program about movement. We're kind of running out of time, so we can't talk too much more about that.
Totally
Give us the name of it real quick.
Motivated to Move.
And so you help get those patients outside of their rooms
get them moving
as much as possible.
Yep, that's great.
So fantastic.
Yep.
Such a great inspiration and a wonderful story, and I'm sure such motivation and inspiration to all of your patients. So thank you so much for joining us and all that you do for our community. We do appreciate it. We do want to remind you, go to our website, abc4.com, and we'll connect you there with Intermountain Healthcare. We'll be right back.